let's talk about something that affects millions of people, but it's sneaky. It often works completely under the radar until bam, it's too late. We're talking about osteoporosis, and you're about to see why they call it the silent bone thief.
So what if I told you that something as simple as tripping over a rug or even just a really strong cuff could break a bone? It sounds pretty crazy, right? But for millions of people, that's the reality they face. So today, we're going to dig into that risk. But more importantly, we're going to talk about the powerful things you can do to fight back. All right, so here's what we've got on tap. First, what exactly is this silent disease? Then we'll get into who's at risk and what to watch out for. After that, we'll hit the good stuff, how to build stronger bones. And we'll wrap up with how doctors diagnose and treat it. Let's get started. Okay, first step. What in the world is this condition that kind of works in the shadows? Let's break it down. You know, a picture is worth 1,000 words, and this one really tells the story. Take a look on the left. That's healthy bone. See how dense and strong that structure looks? Now, look at the bone on the right. That's what osteoporosis does. It creates these big open spaces, making the bone look kind of like a honeycomb. It's way more porous, and you can just see how much more fragile it is. It's pretty clear why a bone like that could break so easily. So here's the bottom line. Osteoporosis is basically a condition that weakens your bones from the inside. They lose their density, they lose their strength, and that makes them super fragile. So fragile, in fact, that even a tiny impact could cause a major break. And that right there is why it's called the silent thief. See, you don't feel it happening. There's no pain, no warning bells, nothing. You have no idea your bones are getting weaker until you have that first sudden fracture. And that's exactly why it's so important to understand if you might be at risk. Okay, so who should be paying closest attention? Let's dive into the risk factors. So a bunch of different things can play a role here. Some of them you just can't change, right? Like if it runs in your family or your age, especially once you're over 60. And for women, menopause is a huge one. That big drop in estrogen, which is a key hormone for bone protection, can really speed up bone loss. But look at the other side of this. Not getting enough calcium or vitamin D? Not being very active? Now, those are things we can actually do something about. And it's not just about lifestyle. There are some specific medical things to keep an eye on, too. For example, being on certain steroid medications for a long time, like prednisone, can really affect your bones. Same goes for some thyroid issues, or conditions like celiac disease that mess with how your body absorbs nutrients. So if any of this sounds familiar, it's definitely something you want to bring up with your doctor. All right, so if this thing is so silent, how on earth are you supposed to spot it? Well, you're right, there aren't really any early symptoms, but there are some signs that can show up later on that we should all know about. When a break actually happens, it usually shows up in one of three places: the spine, the hip, or the wrist. Hip fractures can be really serious, and they often happen after a fall. And wrist fractures, well, that makes sense, right? It's our first instinct to put our hands out to catch ourselves. These fractures are definitely the most obvious and dramatic signs. But what about things that aren't a full-on fracture? Well, one of the classic signs is actually losing a bit of height over the years. This can happen because the little bones in your spine, your vertebrae, get weaker and start to compress. That can also cause that stooped or rounded over posture you sometimes see. Oh, and another thing, if you get this sudden, sharp back pain for no good reason, that could actually be a tiny fracture in your spine. Okay, so we know what it is, we know who's at risk, and we know the signs. Now let's get to the most important part of this whole conversation. What can we actually do about it? This is where we talk about taking back control and building a stronger future for our bones. Think of this as your 4-step game plan for stronger bones. Step 1, get moving with weight-bearing exercises. I'm talking walking, climbing stairs, dancing, anything that puts a little healthy stress on your bones and tells them, hey, stay strong. Step 2, a little strength training. Using light weights or even your own body weight builds muscle, and muscle supports your skeleton. Step 3, fuel up. You gotta eat foods packed with calcium, like milk, yogurt, and leafy greens. And finally, step 4, don't forget vitamin D. You can get it from sunshine or supplements, and it's absolutely essential because it helps your body use all that calcium you're eating. And this is huge. So let's bust a big myth right now. A lot of people think they can just pop a calcium pill and call it a day. Nope, it doesn't work like that. Calcium is a team player. It absolutely needs vitamin D to even get absorbed, and it needs exercise to know where to go to make your bones stronger. It's the whole package, a real team effort. So, what if you're listening to all this and thinking, I might be at risk? Well, here's the good news. We have some really great tools these days, both to figure out what's going on and to treat it. The main way doctors check your bone health is with something called a DXA scan. I know, it's a mouthful. But all you need to know is that it's a super simple, totally painless test. It uses a tiny amount of X-ray to measure your bone density, usually in your hip and spine. In just a few minutes, you and your doctor get a really clear picture of how strong your bones are. And if the scan shows you do have osteoporosis, please know there is so much that can be done. There are some really effective medications out there that can slow down bone loss, which lowers your risk of a fracture. Basically, they help put the brakes on the cells that break down bone, giving your bone-building cells a chance to do their job. Of course, your doctor will also probably talk about supplements, but just as important, they'll focus on preventing falls. Simple things like getting your eyes checked and doing balance exercises can make a huge difference. Okay, let's bust one last and maybe the most important myth before we go. Getting weaker bones, getting shorter, that stooped posture, that is not just a normal part of getting older. It's not. Osteoporosis is a real medical condition. And the best part is, it's treatable. Taking it seriously can make a world of difference in your life. So as we finish up here, I just want to leave you with this one thought. Building strong bones is a lifelong project, right? It doesn't happen overnight. So think about it for a second. What's just one small thing you could do this week to invest in your own stronger future? Maybe it's just taking the stairs instead of the elevator. Or maybe it's adding a glass of milk to your breakfast. Whatever it is, that one small step is a powerful move towards a stronger you. Thanks for joining me.